Well, good morning, Jagender Rana here. The topic of the day is importance of consumable covers in health insurance. Importance of consumable covers in health insurance. Imagine you are undergoing a surgical procedure. Just like you are sure that the doctors will nurse you back to health. You also know that your health insurance will cover medical expenses. And then at the time of discharge, you are handed over a bill which is way more than what you had expected. You now have to pay for bandages, PPE kits, syringes, surgical gloves, and masks, among other consumables used in your treatment. Well, while it seems unfair, your policy had listed them as exclusions when you bought it. Read on to learn more about consumable covers and how it can help you save money. In the world of health insurance, it is quite important to know the various terms and conditions. Being well aware of some of the clauses can help you make informed decisions that will increase the benefits you draw from your health insurance plans. For instance, you should know that cashless treatment may not always be entirely cashless. During full settlement, you may be asked to pay a percentage for the housekeeping items used, like slippers, sanitizers, masks, foam, shampoo, etc. So the best way to avoid such expenses is to have consumables cover as part of your health plan. Let's take a closer look at its benefits. What are consumables? So consumables are medical aids or equipment used during treatment and discarded after use, such as masks, gloves, syringes, PPE kits, etc. In 2016, the IRDAI listed 199 consumable items that insurance companies do not cover. Our insurers have the freedom to include or exclude any or all of the items when it comes to coverage in health insurance. These consumable covers in health insurance is before COVID-19 around 3 to 5% of the medical bills accounted for consumables and people did not mind paying from their pockets. But post-pandemic, the share of consumables in medical bills shot up to around 30%, making it unaffordable for many policyholders, considering the high proportion of consumables in hospital bills. And to make it affordable, many insurance companies started offering consumables covers as an add-on to the base plan. So by paying an extra premium for the add-on cover, you can get financial protection against the hefty bills of consumables. There is a list of consumables covered under consumable cover. The cost of documentation and paperwork, birth and death certificate, admission kit, visitors pass, daily chart, maintenance of medical records, discharge procedures, etc. These are all administrative expenses. So this surgical equipment like glove, mask, cotton, needles, syringes, razors, gowns, surgical tape, syringe, braces, splints, collars, and other surgical disposable items that may be required. Then room expenses, cost of facilities provided in the room such as AC, TV, telephone, attendant charges, IV injections, luxury or injury tax, etc. Then housekeeping, everyday items like toothbrush, toothpaste, tissue paper, soap, shampoo, slippers, sanitary pads, combs, diapers, carry bags, mineral water, etc. So the benefits of consumable cover is the consumables may not seem very expensive when bought as a single item or for a short stay in the hospital. but they can shoot up the bill during an extended period of hospitalization or when consumable items are repeatedly required during a procedure. So a consumable cover can take care of these additional expenses and relieve you from financial stress. As the insurance provider covers the cost of consumables, you can be assured that doctors take all preventive measures during the treatments. Since there is no financial constraint, you will not compromise on your health. Then why consumables are not covered in health insurance? The main reason why insurance companies do not cover consumables in health insurance plan is because the items are discarded after single use. If used in large quantities in any medical procedure, the consumables inflate the hospital bills, resulting in high claim amount. So insurers are therefore reluctant to cover consumable items in health insurance. Consumables are essential medical aids and services which cannot be avoided. In order to reduce the policyholder's financial burden, some insurance companies have therefore launched a consumable cover to provide financial coverage for these items of single-use equipment. So despite having best health insurance plan, you are asked to pay at least 40% of the hospital bills while the insurer pays the remaining amount. Unbelievable. This can happen because the cost of consumables is not payable by the insurer. Consumables cannot be avoided, and so for financial protection against these extra expenses, you have to opt for a consumables cover by paying an additional premium. So, considering the high proportion of cost associated with consumables, this add-on cover can reduce your out-of-pocket expenses. To make it easier for policyholders to understand all these aspects in health insurance policy, the companies are providing the details of these consumables. Now, in recent times, given the skyrocketing cost of healthcare facilities, it has become more essential to have a well-researched and adequate amount of health insurance. However, even if one has an adequate amount of health coverage, it might fall short of certain exclusions and non-payables. In such cases, a large share of the hospital bills become an out-of-pocket expense. So, considering such cases and the ever-increasing importance of adequate health coverage, post-pandemic, some insurance companies have now started providing coverage for many of these non-payables. One of these is consumables cover, which is now offered as an add-on by many insurance companies. Now, what are consumables in health insurance? Consumables in health insurance are usually medical equipments, aids discarded after use, like PPE kits, gloves, masks, syringes, etc. So often they were not covered by the health insurance companies earlier. However, with the pandemic, consumables became a significant part of the hospital bills due to increased uses. So the hospitals stopped mandatorily wears protective gear while treating COVID patients. As a general practice, the use of masks, gloves, and other protective equipments has increased. So this again accentuates the inclusion of consumables under health insurance coverage. Now, consumables cover in health insurance refers to the financial coverage for all the medical equipments, aids classified as consumables, usually the single-use equipment like protective gear, masks, gloves, etc. So one of these is consumable cover, which is now offered as an add-on by many insurance companies. Now, what are the items covered under consumable covers? You might be wondering how a few disposables like masks, gloves, etc. will shoot up the hospital bill considerably. Well, you are not entirely wrong. Consumables is used to form a small portion of the hospital bill previously, and people didn't bother much. But post-pandemic, with the increased use of disposables and protective equipment, the share has shot up. Here is the list of most preferred consumable items in health insurance plans. See, first of all, administrative charges. All expenses incurred due to paperwork and documentation, admission kits, visitors pass, discharge process, maintenance of medical records, and under documentation and other documentation expenses come under the administrative charges. Then housekeeping daily use items such as mineral water, toothbrush, soap, sanitary pads, slippers, comb, shampoo, diapers, etc. The room expenses, the expenses incurred due to the facilities provided in the room, such as AC, television, telephone, attendance charges, luxury tax, etc. Then surgical equipments, cotton, razor, needles, syringes, surgical tape, and other surgical disposables used as part of the treatment procedure, or any other item provided in the product. So the list of consumables as prescribed by the IRDAI is a long one, but it generally serves just as a guideline, and the insurers have the liberty to include or exclude any item in their policy. So the list of consumables might look inexpensive for now, but they for sure can shoot up your bill. To avoid this hit on your pocket, you must consider getting the consumables covers in your health insurance. So there are benefits of consumable covers in health insurance, because several items classified as consumables may seem relatively inexpensive when purchased as a single item. However, when these are repeatedly used during a procedure or treatment, they might amount to a large portion of the bill. In such a case, having a consumable cover can save you from the financial burden of these consumables. Since consumables expense does not fall directly on you and is taken care of by your insurance provider, it ensures that the preventive measures are not compromised during the treatment due to financial constraints. So one of the primary reasons that insurers are reluctant to cover consumables in health insurance is that most consumables are disposable and single-use items. So during any treatment, piles of these are used and discarded. This in turn shoots up the patient's hospital bill that the insurers are disinclined to pay. So consumables are the essential services and items provided for a comfortable and safe stay of the patients in the hospital. A compromise on these would directly mean compromising the patient's health. Hence, it is essential to refrain from striking off the consumables from the prescribed requirement of the patient. A consumable cover makes sure that the expenses of these consumables does not hit a patient's pocket. So, consumables are usually but not restricted to medical aid, equipment, and have to be discarded after use. The cost incurred from the consumables is directly billed to the patient if not covered in the health insurance policy. So consumables are usually but not restricted to medical aids. The cost incurred from the consumables is directly billed to the patient. IRDAI has reviewed a list of 199 items originally listed in 2012 that are non-payable from the insurer's perspective. The list, however, just serves as a guideline, and the insurers have the freedom of including or excluding any of or all items from this list when it comes to policy coverage. So these consumables relate to the administrative charges, to the housekeeping items, the room charges, the surgical items. These are just 40 odd items from the list of 199 that are possibly excluded from your health insurance policy. So most of these seems like an inexpensive everyday items but could make up a serious bill for you. So when it comes to consumables, you lack any decision-making power. Assuming some medical items is available in a price band of rupees 50 to 500, the hospital or doctor decides the brand or quality of the consumables. The results of wastage, say for example a 250 gram cotton roll was opened for you and possibly only a couple of swabs were used, you will be billed for the entire item, not on actual uses. So it is estimated that consumables could make up anything from 5% to 50%, 15% of your hospital bill. 5 to 15, 15% of your hospital bill. So depending on the services availed, you can avoid this cost by considering a small add-on rider to your health insurance plan. The add-on consumable benefits would come at a minuscule percentage of what the actual cost of consumables might be in case of a prolonged period of hospitalization. You now understand how important it is to cover such benefits. It provides consumable benefits as a feature rather than an add-on. Certain companies are there. Say for example Tata AIG, it provides consumable cover as a feature, not as add-on. So not only does it cover all consumable expenses related to the patient's medical and surgical needs, but also covers over 540 different daycare procedures, high-end OPD tests, and vaccination benefits. So before opting for a comprehensive health insurance, you look for a policy which covers all of these things and much more, so you are not surprised by a hospital bill heftier than you were expecting. Heftier than you were expecting. Because when it comes to health insurance, understanding the various components of your policy is crucial. One often overlooked aspect is consumables coverage. Consumables in health insurance plays a significant role in your overall healthcare expenses. Yet, many policyholders are unaware of their importance. So, consumables in health insurance refer to single-use medical items that are utilized during your treatment on hospital stay. These items are typically not reusable and are discarded after a single use. So while they may seem insignificant individually, the cost can add up quickly during a hospital stay or medical procedure. Examples of consumables include syringes and needles, bandages and dressings, gloves and masks, IV fluids and tubing, then sutures and staples. So common types of consumables are covered. Most health insurance policies that include consumables coverage will typically cover the following. Say for example, disposable medical supplies. This includes items like gloves, masks, and other personal protective equipment used by healthcare providers. Then wound care materials, bandage, gauze, and other dressing used in wound management and post-operative care. Then intravenous IV supplies, IV bags, tubing, and related accessories used for administering fluids and medications. And surgical consumables, items used during surgical procedures such as sutures, staples, and surgical glue. Then respiratory supplies, oxygen, mask, nasal cannulas, and other items used in respiratory therapy. It is important to note that the specific items covered can vary between insurance providers and policies. Always check your policy documents or consult with your insurance representatives for a detailed list of covered consumables. So the importance of consumable coverage is always there because understanding the significance of consumables in health insurance can help you make better decisions about your healthcare coverage. This will be for cost saving, for comprehensive cover, for peace of mind, and for better budget. So understanding consumables in health insurance is crucial for making informed decision about your healthcare coverage. By considering the importance of consumables, comparing policies, and maximizing your coverage, you can ensure that you are well protected against unexpected medical expenses. Thank you very much.